the female pelvis, and this is from the frontal view. It's fabricated from plastic. This represents what would be the vagina, and this is not completely anatomically correct. The labia minora would be here, the labia majora here, the clitoris would be here, and the rectum would be located here. I'm going to be separating this model from its base so we can see more closely what this looks like. And as we separate these halves, we'll take this apart here and lay this off to the side. As we take a look here, this represents the rectum, and right here, this represents the bladder and the urethra, which is where typically one would urinate from, and the urinary stream comes from. This is the pubic bone. As we see right here in a smaller than typical version, this is the vagina, and this would be the uterus. Typically, while the clitoris would be located just anteriorly here, one would enter the vagina, and about 2/3 of the way up, which is about 2 inches in, one would locate the G-spot just to the back side of the urethra, which would be right here. So in this spongy-like tissue, this has been identified as the location for the G-spot. Injections are performed with a special instrument called a speculum, which is inserted into the vaginal canal and has a special little window in the uppermost blade, and that allows us to identify the location of the G-spot and perform an initial injection to anesthetize the area, and following that to proceed with an injection of a filler substance which enhances this area, right in this area.